Hi everybody, Tim Wyatt, physical therapist, clinical specialist here with Aspen Rehabilitation. We are here with a patient of ours who has undergone our Capsular Contracture Prevention Program. She has had a history of capsular contracture,
Yes.
had a surgical revision to address that contracture, and was involved in our program knowing that even with revision surgery, the risk of re-encapsulation is there. You have a history of surgery with a re-encapsulation. So the attempt this time was an effort to prevent another encapsulation because, as we know with surgical revision, and you are a product of this, even with the best surgeon and techniques and skin strips and antibiotics and no-touch technique, the immune system is really the guiding factor in all of this, and the recurrence rate for getting contracture again statistically can be up to 70%. So knowing this, we instituted our program where right after your surgery, right at 2 weeks, we started the Aspen protocol, which is a series of medications, antibiotics, combined with the Aspen technology, which has a goal of achieving this. Basically, when the implant goes in, the capsule begins to form about 3 days after surgery. And that capsule is very thin and permeable. And what happens is this capsule shell, represented by the pink outside shell here, once that forms, if the immune system reacts to it, it creates the classic symptom which you noticed, which was the high and hard and firm and sometimes painful. Was yours painful?
The second retracture was very painful, especially towards the end, the last couple of months. It was a constant kind of ache, almost like what you have there, where there was this rubber band that was constantly pulling on the implant and trying to literally push it out of my body. Is the only way I could explain it.
Right.
Is how it felt.
And pain may be associated with contracture, it may not be. We don't really like to grade pain. Some surgeons and some of the grading systems for contracture denotes pain, but pain is not really the issue. The issue is mostly the asymmetry, meaning the contracted side sits higher. It's firmer to being squeezed. You notice typically in a bra or bikini, that's kind of the biggest cardinal sign that we see. So with this, we started the antibiotic prevention program. Even after your surgery, we noticed that the implant was still a little bit higher. So we wouldn't call it contracted early, but we had to do a little bit more work than our traditional program because it wasn't perfectly soft and symmetrical from the start. So we had to do a little bit more work, but successfully got you back to what you would consider your baseline. In other words, what you looked and felt like even before implants.
Yes.
Right, that symmetry plus the augmentation.
There was nothing there before implants, just to let you know.
Right, but with the augmentation, that asymmetry still exists. So if one breast was smaller and bigger, even though surgeons try and modify that, your relative look after your procedure is still kind of the same thing. So successfully, we got you to that point. Right, okay,
like
great.
the day after surgery.
Yeah.
That squishy feeling that you get. Super squishy.
So the goal of this is correction as well as maintenance. So we're here, how far out after your surgery?
Almost 7 months.
Almost 7 months.
6.5, almost 7 months.
Perfect. So this is a good time period because you had your surgery, we've done the course of the antibiotic treatment, we've followed up with you, reassessing you. We went through a period in which we've done nothing whatsoever. In other words, you were not allowed to do any massages, nothing at all. And for the past 30 days, there's been no change. You've maintained the softness, the symmetry.
Yes.
Okay. All right, great. So the goal of this being prevention, as in your case, is really speak with your surgeon or call us directly. The reason why we're doing this video today is because we want to let women out there know that there is an option. There is solutions for you. And the best solution is prevention. It's cheaper, It's simpler, it's less work, and the trick is let your surgeon know that you want to be a part of this program and pre-schedule it and pre-plan it.
Yeah.
Again, there's always the option for all patients that have existing contractures. You don't necessarily have to go to surgery immediately. We can always start the treatment. We have a very high success rate even with existing capsules, but in certain cases you may or may not be a candidate because of bacterial contamination or trauma. You told me that you were working out in the gym and something happened. What happened?
I was doing a snatch, an Olympic weightlifting exercise, and I threw the weight up over my body and I stretched out like this, and I felt something pop across my breast. And after that, I noticed the some down pulling underneath the nipple, and then the stiffening and the lifting and just contorting the breast happened.
Right. So we'll see that commonly in the areola, especially if you have an infraareolar incision or an incision, that half moon on the bottom. One of the classic signs associated with contracture is that incision will dimple in and the nipple will look down. And then as it advances, what happens is the implant rides up, the nipple looks down even more, and the depression comes even greater. So we see surgeons who sometimes try and manage this and manipulate it with injections, medication, scar mobilization, or machines, but it doesn't have a high success rate because until you treat the capsule, which is the goal of our treatment, you're not really going to get that implant down, push that incision out, and pull that kind of puckering off the implant. So those are the classic signs and symptoms: high, hard, unevenness, and potentially the incision dimpling in. So as discussed, trauma is a trigger for capsular contracture. Heavy weights, trauma to the breast. I've had patients open car doors and hit their breast. It creates a bruise, painful swelling. This triggers the immune system due to blood being in there. Even on a microscopic level, triggers the immune system. Of course, the classic onset of contracture that comes way late in the game. In other words, you have a surgery and I get a contracture 1 year, 3 years, 5 years down the road, can be a result of infections, immune system disorders, thyroid dysfunction, all kinds of other things. The biggest trigger being surgery. Surgery is the biggest trigger, and that's really what we're trying to avoid in all of this, is giving options to not have surgery if you don't have to. In your case, it was a little advanced, so we had to go the surgical route and then do prevention right off the bat.
One thing I would like to add is I noticed the first probably sign of it was probably the temperature change of the breast and the implant. Because I just had the one side, I noticed that the left would be cooler than the right, and I had the contracture on the right. And here in Florida, it's a little tough sometimes. They're warm almost all the time, but when I was in colder situations, I would notice that my left breast was cold to the touch, and then the right was at least body temperature. Not burning up, nothing of that nature, but it was definitely warmer.
And that is one of the immune system responses, is that if indeed that was bacterial or the body itself recognizes the implant as a foreign invader. Because the reality is all foreign things in the human body get this capsule shell. So artificial prostheses, breast implants, pacemakers, they all form this capsule in a natural response. The problem is if that capsule thickens and contracts, and that warmth that you were feeling was most likely the immune system starting on that capsule, thickening it, tightening it, and getting it basically protecting you, thinking that the implant is sort of a Trojan horse sneaking into your immune system trying to do something to you, when the reality is it's not. It's just kind of going through a natural process. Again, the trick is catch it early, early prevention, even with an existing capsule for any patients, whether it's a month out of surgery or 10 years out of surgery, following kind of good common sense of if it's higher, harder, less squishy, a feeling of tightness, My patients report, when I lay on that side or I'm face down and I feel it, I know there's something different on that affected side versus the other side. I don't even know I have an implant. So catching that early is really the key, whether it's right out of surgery, which starts at 2 weeks, or down the road, however that starts. So you're happy with your results?
I'm very happy.
Okay, we just examined you. You look great. Position looks great. Softness is great. So at this point, it's pure, enjoy your life, do everything you want to do. There's no restrictions. The only thing that we recommended is watch immune system triggers, colds, flus. Good advice is stretching the pecs in the gym, especially given your history.
Yes.
So tight pecs, and maybe when you did that lift, what happens is if your pecs are tight, especially with women who have protracted shoulders, if your pecs are tight and your shoulders roll in a little bit, I don't know if the camera can catch that, but you can see her shoulders are a little tighter, that automatically makes your pecs tighter, and it makes it more prone that when you are in the gym or working out, doing a heavy weight, that pec contracts and tears a little bit. So stretching the pec muscles is something that's important. We showed you how to do that. We gave you a little handout. Allows you to decrease the risk that contracture is going to come back in the future. Great.
Yes.
So anything else you want to add to women who may be seeking this treatment, or?
Know your body. If there are changes, talk to somebody about it, either your plastic surgeon, Dr. Tim, and get it taken care of ahead of time. Don't be afraid to ask questions. They're always here for you guys. Other than that, treat it early and your outcome will be a lot cheaper and a lot easier in the long run.
Awesome. Well, thank you so much.
Thank you.
Glad your results are the way they were. Any questions, anybody can call us on our main line, 954-341-7875. Question, concerns, feel free to give us a call. Take care.
Thank you.
Hey everybody, Tim White, clinical specialist. So just a follow-up after our patient that we just interviewed. Our patient did great. Great to have a testimonial talking about her experience, but I'd like to talk about something else that is a reality regarding these issues. Our patient was lucky that she lived local to us here in our main South Florida clinic, but unfortunately, many of you that may be suffering from this may not be a location that you can get an Aspen treatment. This technology can be placed in any surgeon's office. The benefits of having this in your surgeon's office, obviously, is your surgeon gets to manage your care. You'll be more likely to have this available to you for prevention immediately afterwards. Your surgeon is going to be more likely to recommend it, and proximity, as most patients may be having surgery near where their plastic surgeons live. We recommend having a conversation with your surgeon about the Aspen treatment. Connect us with your surgeon. We can reach out to your surgeon. It's a very simple process of getting this technology into their office so that they can have it and use it for sake of you, the patient. Again, prevention is key. Early intervention is key. Starting right away is the most important thing. The most damaging thing that we see is playing the waiting game of let's massage to see if this can be fixed. Let's take asthma medications and whatever. Best thing is institute the Aspen treatment right away. So again, any questions, concerns, putting this technology in your surgeon's office, you can visit our website at aspenaftersurgery.com. Call our main number at 954-341-7811.